Hi, my name is Kate Kapner, and I am a board-certified nurse practitioner in general internal medicine at Virginia Mason's University Village location. I chose to work in general internal medicine because I really love the idea of primary care, where we get to treat the whole patient. We get to see a wide variety of conditions and also get to assist the patient with preventative care, which I think is so important. We treat everything in primary care. We are a jack of all trades and get to see a little bit of everything and then treat within our scope, and then as needed, we'll refer to a specialist. Within primary care and general internal medicine, I have a specific interest in women's health as well as travel medicine. I think that this is a hopeful time in medicine. There's always a lot that's changing, but Virginia Mason puts a specific focus on evidence-based practices. One of the things I love about my work is the continuing opportunity to always be learning. I try to use each patient interaction as a chance to learn something to improve myself as a provider. When a patient has been struggling and we've worked together, it feels like a victory when they are able to achieve a good outcome. It feels like we are a team and that we have kind of come together and we won that round. I am inspired by my patients. I feel that when a patient has a chronic condition like diabetes or high cholesterol or obesity and they're able to turn those conditions around by making real life changes, I think that that's pretty inspiring. And I get that the struggle is real. My patients have heard me say that, and it's really great when they can do that with only needing some pharmaceuticals, or being able to decrease the amount of pharmaceuticals or even eliminate them altogether. My approach to keeping the patient at the top of the pyramid is to continue to focus on shared decision making and working with the patient to develop the treatment plan and outcomes. I make each patient feel unique by doing the tried and true method of treating each patient like they were my family member, or thinking about if this was my mother or my brother or my sister, how would I want them treated and what kind of treatment plan would I do for them. A team approach benefits my patients in many ways. One of the ways is having a good supportive team where I know that if I'm out or not able to be at work, I can have full trust and confidence in my colleagues that they'll cover my patients, and they as well have that confidence in me, as well as our support staff of medical assistants and nurses and a front desk and lab and everybody who really kind of comes together to make the whole patient experience the best it can be. I chose to work at Virginia Mason because I had previously worked at Virginia Mason. I had worked as an inpatient nurse for several years, and when I came back to Virginia Mason, it just felt like a homecoming. And I was just already familiar with the patient-centered care and the focus and attention to detail. I built a relationship with my patients by really putting an emphasis on shared decision-making and working with them to develop a plan of care that they feel comfortable with and I feel comfortable with. As a transplant to Seattle, I really enjoy all that the Pacific Northwest has to offer. I have come to love camping and hiking and kayaking, and I also love spending time with my husband.